Hi, I'm Dr. Kristen Jacobs from Ooh La La Spa, Anti-Aging and Wellness, and I have our nurse Jill today, and I have our patient Stephanie. And today we're going to talk about consultations with Coolsculpting. So Coolsculpting is a really exciting procedure that we do here that just gets rid of the excess, say, belly fat or arm fat, and we'll talk about all of that. And what we want to do is walk you through exactly what a consultation will be like. So first of all, we've had our Coolsculpting machine for over 7 years now. We've done over 2,300 treatments. So we've all been to Coolsculpting University, so we have all the latest and greatest training and the expertise to help give you the best Coolsculpting treatment. So what we're going to do is Jill's going to go ahead and scoot over here, and she's going to show you how the consultation works.
Okay, so I'm just going to jump right in. A few high points about Coolsculpting. So there is visible fat reduction. It's the one thing on the market out there that is FDA approved to eliminate fat cells. There are other treatments that just shrink the fat cells, but this particular treatment is eliminating the fat cells for good. There's been more than 6 million treatments performed nationwide, and we actually were just discussing in our clinic, how many have we done?
Over 2,300.
Over 2,300 in our clinic. Long-lasting results because the results are permanent, and it has been the choice for fat reduction year after year. So if you can imagine, this is what the fat pad in the particular area that we're treating looks like initially. And the blue cells in number 2 are showing what cells have been cooled to a degree during the treatment that they will actually be excreted through the lymphatic system post-treatment. So basically what that means is the blue cells will turn to liquid and you will pee them out. You won't see it, you won't smell it, you won't feel it, but this is the process that is getting you to that smaller fat pad in the end for that particular area. And over here you can see that there are a large range of areas that we can treat. We can treat the chin, back fat, abdomen, meaning the upper and lower abdomen, bra fat, upper arms, the flanks, which is the area right behind the back, the upper and lower flanks. We can also do under the buttocks, and we can do inner and outer thighs. A lot of patients will ask if Coolsculpt is safe for their organs, and that's what this diagram is going into. So post-treatment for Coolsculpt, you will continue to get results for 90 days, and you will start to see results at 3 weeks. This is basically describing, you see a large serving of fast food french fries here. It's basically describing how the breakdown of the cells is very similar to your body processing a large serving of fast food french fries, except for when you go eat a large serving of french fries, your body has to process it all at once. When you do Coolsculpt, your body is basically processing 1 french fry a day for those 90 days, and so it's actually less taxing on your organs than eating fast food. And then here we're comparing Coolsculpt to weight loss. So this person has lost weight, this person has had Coolsculpt. In both situations, their fat pad is smaller. The nice thing about Coolsculpt is it's actually eliminating fat cells. So when we lose weight, we're shrinking our fat cells. When we gain weight, we're basically just inflating those fat cells back, and you're back where you started from. So the nice thing about Coolsculpt is you're shrinking that fat pad by actually getting rid of fat cells. So if that person, which we talk about diet and maintaining a healthy diet and exercise post-treatment to maintain those results, but if that person was to gain weight, it's going to go somewhere, but most likely it's not going to go as much to that area because that fat pad will stay smaller for good. Alrighty. And then this goes a little bit more into, so I'm going to hit some high points as far as what you can expect and that type of thing. So what does it feel like? When you're hooked up to the machine, you will initially just feel a little bit of suction. Your tissue pulls into the applicator and it gets colder and colder. I like to describe it as your toes in the snow. When your toes are in the snow, when you're out scooping snow in the winter, they almost start to get achy before they go numb. So that's the type of feeling you'll have with Coolsculpt. Colder, starts to feel a little bit achy, and then you'll go numb. That happens about 5 minutes into the treatment, and then you're numb for the rest of the cycle. Most of the cycles are 35 minutes, and some of them can be closer to an hour. When you come off of the machine, then we do a massage in that area, and that massage is very important because it starts that process of liquefying those fat cells. So once we do the massage for 2 minutes, during that time frame, we're heating that tissue back up. So it's like you scooped the snow, now you've come inside, and when we heat that tissue back up, it can be a little bit achy, but again, very tolerable. And after that, we treat whatever needs to be treated within that area. So if it's an abdomen, it's probably a couple cycles, and then you come back in 30 days for a second treatment. So we're gonna assess Stephanie and see what areas she would need to be, or what treatment plan she would need for her abdomen. Post-treatment, you will feel numbness and tingling post-treatment. The numbness will take place first. As the numbness starts to wear off, you will feel some tingling, and it's one of these things where you touch your skin and you can't really feel it. And that lasts for about 2 weeks, and then some minimal swelling for about 2 weeks as well. So we like to start by asking, what areas bother you, and I'd like for you to pinch what fat bothers you, and then I develop a treatment plan based on her needs, basically.
This bothers me, these bother me, this bothers me, and this bothers me.
So we're gonna start with her abdomen because that was her top priority, and start with that first. So basically what we do is come in, and I'm gonna pinch the area and find where exactly that fat pad starts and finishes. And then I'm gonna go ahead and put the applicator up to it so you can see what surface area that would cover. I don't have a marker. Do you want me to mark? Okay. So for her area here in the lower abdomen, this is actually the cycle that we would use. So you can see the surface area that would cover. And then Dr. Jacobs is going to hand me the handpiece, and I'll show you how that sucks into the handpiece. So basically, the tissue is going to suck right into this handpiece. This is a 45-minute cycle, so we would treat here. We would do another one on this side, which is also a 45-minute cycle, and you can see what it looks like as far as the tissue pulling right into there. The cooling panel is here, so that's what's gonna freeze that tissue, and then we will have a cold gel pad on the surface of the skin, and that will protect the integrity of the tissue from her stomach. And then up here, she would do 2 more cycles, here and here, so you can see again the surface area that would cover, and it would address this whole area and here. And so I'll hold this up so you can see basically the tissue would suck right in there. Okay, so for Stephanie, we're looking at 2 35-minute cycles and 2 45-minute cycles, and then she would come back in 30 days and repeat that. We always treat the abdomen twice. We're getting about 20 to 40% reduction with each treatment, so those 2 treatments build on each other. And then we do follow-ups at 30, 60, and 90 days to make sure that we're seeing change. We pull those photos up side by side, make sure you're seeing change and you're happy. And I have to say, they're my favorite follow-ups to do because they're so easy. It's right there in front of your eyes every time. Coolsculpt really is amazing.
Good. You want to talk about her flanks?
Sure. So again, with your flanks, I'm gonna have you pinch the area that bothers you. Good. And then I'm trying to see, they probably can see it best if she turns, have it so that your back maybe is facing that. There we go, that's perfect. So what flanks do is help accentuate the waistline and give you more of an indent here. And then we wanna treat the area right above it or right below it. In this case, what bothers you? Would you say it's your upper or your lower flank?
The whole thing.
The whole thing. So the cool thing about it being the whole thing is we really can treat both. So in her situation, I'd actually start with the upper because you can see that we can pull this tissue here pretty easily. So we start where the fat pad starts, and then we will come around and treat all the way over here until it stops. So the awesome thing is it treats this whole area. I think it should actually be a purple. So you can see how it really would, and then fit right in here, and this is gonna suck into the applicator with the pressure from the handpiece. And again, that's a 35-minute cycle. We would do the same thing over here. And then she actually could treat lower flanks as well. In her situation, I'd probably say do your upper first. Let's wait 60 to 90 days and see what your results look like. Because honestly, after she does her upper, I don't know if she would really even need her lower flank.
Can I do the back of my arms too?
Sure. So I'm gonna have you, for arms, go ahead and turn facing the mirror and put your arms up like this and then just tip your hands in. Actually up like this and then tip your hands in like that. Perfect. So with arms, we are basically treating the tissue that hangs lower. And arms are probably one of the trickiest things because you have to be the exact size of the handpiece for it to work properly. So we assess for that. So it would start here and then we pinch where that fat pad ends, which she's actually a perfect candidate right here. And I'll show you, if you want to hand me the circle, I'll show them exactly where that would go. And then now turn around because we attach it from the back. So basically it would attach right here. Arms respond really well. In fact, they respond so well, a lot of times we'll do one treatment and then we will have you wait the 60 or 90 days before we decide if a second treatment's needed in that area. That's typical for arms, inner, and sometimes outer thighs. Other areas we know it's absolutely going to take the 2 treatments. And then chin. So go ahead and bring your chin down just a little bit. There's a couple different ways we can treat chin. So we can do a straight on or we can do a side by side. So we're going to take a look at Steph and see what treatment plan works best for her. And here's the straight on. Let's check. She actually could fit a side by side. So we would do one here and one here. It really helps reduce this fat pad here. It does actually tighten the skin and helps to draw that up, which is amazing for this area because it will define the jawline as well as eliminate the fat in that area.
So as you can see, I rely on my nurses to start the conversation with the patients, and then what happens is before treatment, they grab me and I come in the room and I 100% of the time agree with their treatment plans. And sometimes we have to reevaluate the second time because as we lose those fat pads, you may not need the bigger one that she showed. You might be able to get away with the smaller one. So we're always evaluating, we're always making sure that we're giving you the best and right treatment plan because what we want to see are results. So as I said, our clinic believes 100% of results. What's that? Photos, yes. So this was, so what we do is we take photos too. So our next video is going to be about Stephanie actually getting her photos and getting her treatment, and then we'll do a follow-up even after that video about what her results look like. But photos are so important because you forget what you look like. Now, you should be noticing a difference with your pants or your, your dresses or something like that, but sometimes it takes a little bit longer, so that's why photos are so important. So if I were to stress, the biggest thing is that going to a clinic with a lot of experience, so again, over 7 years experience here and over 2,300 treatments, going to somebody who treats the appropriate way with the correct treatment plans, meaning treat and then 30 days later treat again, and then making sure you're seeing your before and after photos. So we absolutely love Coolsculpting. We think that it is one of the best treatments that we do. As Jill says, it's one of her favorite follow-ups because our patients really are happy. So if you have any questions or want to come in for a consultation, please give us a call at 618-288-9117.